Okay, and we are live in 5, 4, 3, 2, 1.
Do we have a quorum, Amy?
It looks to me like yes. I don't know if Bridget was able to get connected or not. She's our office manager there and was going to take roll and everything. Norma, do you know if she's around there? Are you at home or at the office?
I'm at the office. She's here. She's trying to get on.
Okay. I see 1, 2, 3, 4, 5, 6, 7, 8. That should be more than enough for a quorum, Judge, if you want to go on, and I'll try to take notes in case Bridget's not able to see or hear us.
Okay, well, we'll go ahead and call this meeting to order. And Bridget, if you're there, can you take a roll, please?
She may not be there. I have the list. I can do that for you. Let's see. Patty Gwynn.
Here.
Bruce Jasper. Dr. Jasper. I see his name. Dr. Jasper, are you able to unmute? You may not be. He's here. Judge Kelly.
Here.
Dr. Perkins. Jim Wesley. Reggie Cheney.
Here.
Rodney Dick. Jim Muse. Dr. Muse.
Here.
Dr. Schluter.
Here.
Dr. Shea. And Rebecca Whitus.
Here.
That is 1, 2, 3, 4, 6, 7, 8. We have 8, sir. That's
Hey,
more than enough.
you didn't call me.
Oh, sorry, Dr. Drake. It still says Dr. Flazade on my list. I hadn't changed you over. I apologize, Dr. Drake.
All right. I think Jim
Dr.
Wesley's in the hospital.
He is. I was going to mention that. He had taken a fall, I heard, and is not doing well. So I sent flowers this week and trying to get updates when I can. But the last
He's
I heard,
on rehab floor now.
yeah, he's got a long road of recovery, I think.
Okay. Well, let's keep Jim Wesley in our prayers then. He's definitely been a faithful member of the board for a while now. We'll go ahead and move on to health education, Pulaski County update.
All right. Thank you for sharing my document. Hello, my name is Melanie Jones, and I'm a health educator here at the Pulaski County Health Department. And I have spoken with you all last year during the Board of Health meeting. And so I want to thank you again for allowing me to speak again at this meeting. And so I just want to give you just a quick overview of the data from Pulaski County in case you're interested in that. Health education is continuing to do community programs virtually just due to the COVID pandemic. And we're also working through accreditation as well, because this is the year for the health department to be reaccredited. And so if you'll see there in your packet, the data there on Pulaski County specifically, and we do have some demographic data on the first page, including population, household income, unemployment, children with single parents, grandparents responsible for grandchildren, and poverty. And those numbers are also, you can see that the green number is Pulaski County's number. And then you can see there what the district is. And so the district would be the 10 counties that we serve, and then the Kentucky data there underneath that. And so on the second page, you'll see some specific priority health issues. These health issues have been identified by our health coalition. It's called the Working on Wellness Coalition. If you're interested in that coalition, we do have a Facebook page that I try to update or put updates on, or you can email me. And I would love to answer questions, or if you ever want to hop on to one of our meetings, that would be great. So our two priority health issues are chronic disease and substance use. So those are both kind of broad, and they encompass a lot of different things. And so we can put activities inside of those priority health issues that address a lot of different things in the community. And so some examples of those underneath there are obesity, smoking, diabetes prevalence, drug overdose deaths, excessive drinking, and then teen birth rate. And so we wanted to list those for you so that you could see that those are ones that we want to focus on in our community. And so again, the green number is Pulaski County's data, and then you can see how that relates to the district and Kentucky. And so we feel that those are the priority health issues. And then also looking at teen birth rate, the health educators are continuing to do our teen pregnancy prevention program in schools. Thankfully, we have been able to do those virtually. So we're thankful for the partnership with the schools that we're able to do that. And teen birth rate, even though it does look kind of high there, it has decreased over the past several years. Okay, and then the last page has some statistic data on there. I think it's the last 2 pages. And so you can see how Pulaski County is compared to Kentucky on all of that data. And then we can also compare the 10 years. So we have 2011 and 2021 data. And so it's in your packet, so you're welcome to look that over. And if you have questions, you're welcome to ask me. And so we are also continuing to do our coalition meetings, but we're doing those virtually. We have had several in attendance, and I actually had one today, and so it went well, and I shared this data with them as well, just the new updated data. We also are providing smoking cessation classes for the 10 counties. We're doing those virtually. So we're trying to continue to do our programs and to be involved in the community, even though in person is not available right now for us. And so we are thankful to be able to do those virtually, and people are attending those. And then lastly, we are working on accreditation. And so part of that is updating our community health assessment. That is located on our website, and we're going to put the most updated data. We're going to publish that on our website on the 21st, which is next Monday. And so that will have the most updated data for all 10 counties. And then each county has the specific data for that county. So kind of like what I'm showing you here. And then within that, we also have our community health improvement plan, which is what we call a CHIP. And we're going to be completing those in March, and our coalition is going to be working on those. They have activities in there that we as a coalition want to work on to help with the community, to help address those priority health issues. And so we want to have that available for you all so that you can know what's going on in your community. And we want to be involved also and be a resource for the community as well. And so if you have any questions, you're welcome to let me know, or if you need to call me here at the health department, my extension is 2280. And so thank you so much for allowing me to be here today.
And I do apologize that document did not, that's the only document that did not make it into y'all's packets. I forgot to tell Melanie that before the meeting started. since the packets were put together a few days ago, that actually didn't make it in, but I was able to get it on screen here. If you guys are wanting a copy of this, reach out to Bridget and I'll make sure that you get one. Sorry for the confusion on that.
Yes, sorry about that. We'll get that to you if you want it.
Okay, do we have anybody have any questions for Melanie? Okay, if not, thank you, Melanie, for your report. We'll move on then to approve the minutes from our previous meeting, which you all received a copy of. Would there be any additions or deletions to those minutes, or would we have a motion to approve those as read?
I propose a motion to approve those.
I'll second it.
Okay, so that was Dr. Slater and Reggie Cheney. Any further discussion? All in favor, please signify by saying aye.
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 And any opposed likewise? Okay, that motion carries. Looks like there's no old business we need to discuss on our agenda. We'll move into new business, and first item there would be our financial statements report. Ron, I think you'll take us through those.
Yes, sir. I'm going to share my screen. Can everybody see that screen?
Yeah.
Yes.
In some years past, we used to send the financials out back, sometimes August, September, October. In y'all's case, we probably couldn't send them out till at least October, November, depending on when the audit got done. There was obviously no point sending out financials until the auditors approved them. And then normally the audits didn't get done till at least September, October. So I decided this year and moving forward to start bringing just giving you the financials in your board packets, so you have them notated in there, and then just start presenting them every year at the board meeting. In addition to the budget and everything. I'm not going to go in detail on them, but I wanted y'all to get a picture of how you ended this prior year, June 30, 2021. If you have any questions, please feel free to stop me, or you can ask them when I'm done here in just a second. After I am done with the financials, I'm just going to go ahead and move into the audit unless there's any questions. And like I said, I won't spend a lot of time on the audit because the audit reflects to the penny what's going on in these financials. So this is your financial statement for the year ended June 30, 2021 for the Pulaski County Public Health Taxing District. You began the year as of July 1st, 2020 with a cash on hand of $721,719. You had a total receipts during the year of $1,376,129. That's comprised of all the normal revenue categories: real property, tangible, motor vehicle, delinquent, other taxes, and interest income from your bank accounts and one CD. That gave you a total cash available before expenditures of $2,097,848. And then your total expenditures for the year was $1,311,443. And as you can see me sharing my screen here, all the categories that's comprised of, once again, all normal categories. But I'll highlight a few of the big ones. Obviously, your district management fee, which is comprised of it's the fee, the 2.8 cents to be part of the district every year. And then grants and donations. You guys decided to do some grants last year and spent $25,000 in there. And like I said, totaling the $1.3 million. That left you with a cash on hand at the end of the year of $786,405, which you can see reflected here on this next page here, which is page 7 in your packets on the balance sheet. And you can see the breakdown between your checking account, which is $445,853, and your CD, which is $340,552 balances as of June 30, 2021. Moving on to your profit and loss budget versus actual. This is one I thought y'all be more interested in. This is how y'all actually finished during the year with your budgeted items. This is all the items you budgeted and how you finished comparatively speaking. As you can see, as a whole, and you actually finished well above budget. It was a quiet year, not a quiet year with COVID, but a quiet year with spending for the most part, at least in regards to staying under budget. We had budgeted as a whole that you were going to finish with a $42,000 loss, and you actually came ahead $64,686. Most of that, as you can see, was that we were under budget on our revenue projection. They had good collections this year as a whole. So the in a couple of those categories, and I think due to timing as well, caused some of that in regards to how that was done and how that was structured. But you came out 53,000 ahead in total taxes and revenues, and then your as you can see, except for one category, you came out under budget in all your expense categories, except for dues and subscriptions, which of course we had enough left over in miscellaneous costs down here to cover that remaining just small $35, leaving you $107,000 over budget. Normally that's not going to take place, but just because of how the timing of the revenues came this year, and just being a quiet year with different things going on, there wasn't a lot of big major costs as there's going to be the year we're in now, and into next year, as you're going to see on the budget here in just a second. So it's good y'all came out ahead. That goes back into your budget, which you can use to put to good use this upcoming year in the budget. Does anybody have any questions for me in regards to those three financials before I get into the audit? Okay, I'll move forward into the audit. This is your audit prepared by RFH PLLC as of June 30, 2021. Once again, I'm not going to go crazy into this because the financials will reflect exactly what happened here. I do want to read the main couple notes that the auditors wrote for us. If you look on it'll be page 12 in your handout under the paragraph titled Unmodified Opinion on Regulatory Basis of Accounting. It says, the auditor said, in our opinion, the financial states referred to above present fairly in all material respects the assets, liabilities, and fund balances of the Pulaski County Public Health Taxing District as of June 30, 2021, and the respective revenues and expenditures for the year that ended. That basically means in regards to the actual financials, we had a clean audit. The financials look clean. Per their audit, everything was clean with all of our books and tidied up at the year end. So that's a good audit. They also report here in a second on how we comply with government auditing standards, which I'll get to in just a second. These are all the financials that they basically put in nicer, cleaner form for the audit, that they reflect exactly the financials I had just read to you. So I'm going to go ahead and move on from that. I am going to read this note. All these notes are the same notes they give you every year in regards to cash and related parties and things like that. But this one they've done it now for 2 years. They're probably going to stop doing this, I would guess, next year. But this COVID-19 pandemic note, just to notate this, since early 2020, the COVID-19 pandemic forced certain restrictions in the United States and the state of Kentucky. The economic impact of the pandemic could result in a negative impact on the taxing district's revenues, which, as you guys saw, it did not. It didn't hurt y'all in the least in that. But the auditors felt they needed to put that in there just in case. The duration and pervasiveness of the pandemic are uncertain as of the day of these financials. The taxing district is continuously evaluating the impact of COVID-19 on its operation and finances. So that's something the auditors started putting in whenever COVID-19 came. This is the report I told you how we comply, how Pulaski County complies with government auditing standards. I'm going to read this last line it's page 17 of your handouts under compliance and other matters paragraph. The last line says the results of our tests disclose no instances of non-compliance or other matters that are required to be reported under government auditing standards, which means once again, we are in compliance. We have a clean audit. We are compliant with our financials and in compliance with government auditing standards. So as a whole, our audit was clean. Our audit was good. Do y'all have any questions before we move into the next items in our agenda in regards to the financials or anything about the audit? And of course, you have that in your packet. You can always ask me another day after the meeting. Send me an email, call me, whatever, at the office, and I'll be happy to discuss anything with you.
I believe we need a motion to approve the audit if it's something that everyone agrees to.
That's correct.
I'll make the motion to approve it.
I'll second.
I didn't see who made the motion in second. You have that?
Jim Hughes, second.
I think it was
Becky.
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 So we have a motion and a second. Is there any further discussion? If not, all those in favor of accepting the budget as presented, signify by saying aye.
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 Any opposed? Okay. That motion carries. So we'll move on to the next item, which is to set our local tax rate.
I'm going to ask Ron to go ahead and continue with his talk on this. We do this in 2 steps. He's going to actually present the budget to you in conjunction with the tax rate. You can see it a couple of different ways here.
Thank you, Amy. Just to piggyback off what Amy said, as many of you have been on here before, I know one or two of you are new or haven't been here or haven't been on the board maybe in a year or two. You guys have to obviously approve the tax rates before accepting the budget, but we always thought it made more sense to include the tax rates and show you the budget with the perspective of the tax rate so that you can make a more informed decision on which tax rate you want to choose. I'm going to start here at the top, and I'll try and zoom in a little bit, but I do want to show the 3 categories, so I don't want to zoom in too much. At the top, we show you a calculation that shows how we arrive at our estimating opening cash balance as of July 1st, 2022. So we start with our balance as of our most recent period when this budget was prepared, which is December 31st, 2021. You had $924,399 in your checking accounts and $342,263 in your CD accounts, totaling $1,266,663 in total between cash and CDs. We project based on what you've already received and what you budgeted that your remaining real estate taxes, motor vehicle, tangible, delinquent, and telecommunications taxes combined will be another $233,154. Based on your account balances and your remaining receipts, we're projecting your interest in your checking will be $1,387, and your CD interest from the rest of the year from January to June 30, 2022 will be $1,711, with a total interest of $3,098. And that would give you a total receipts of $236,252 and give you a total cash balance before expenditures of $1,502,914. Your projected remaining expenditures through the rest of the year into June 30, 2022 is your second half of that 2.8 cent fee to be part of the district. We've already paid the first half back in late November, middle of December, and that second half will be paid back to the district sometime around May, early June. So that's that $667,102.
Where is that? I'm lost on this form and where you're going.
Let me see if I can highlight it for you, sir. Hang on just a second.
Oh, here it is.
Okay.
Okay.
You see where I've highlighted the number above here?
Got it. Okay. Thank you.
Sorry, I highlighted the smaller number too, but the bigger one there.
Okay.
Okay. Is everybody good? Okay. So moving on, the advertising and printing costs right beneath it. We're projecting another 561 to be spent there. The audit, as of when this was ran, we still hadn't paid our audit fee. The audit was completed, but we weren't invoiced as of yet from the auditors. So you still got to pay the $1,500 that we owe them for the audit this year. The maintenance and repair category, if you remember, there's miscellaneous cost in there somewhat. So as a result, you may not spend all this remaining maintenance and repair, but we're budgeting just in case that you do, you need some major repairs or anything done. So remaining costs in there of $11,774. You have remaining dues and subscriptions that you owe to KPHA, Cowboy, and SPGE of $965. Your board expense, which is $500, which you probably won't be spending again this year because of COVID. We normally spend that on food and everything for the meeting. We may use that a little bit here and there, depending on if we have a special call board meeting or something that may need that. But for the most part, we probably won't need that $500, but we project it anyway in case we do. No more mini grants need to be spent. You've already spent that. Your building improvements to be spent still on what was budgeted last year, which I believe was flooring related. You still got to spend $31,000 there. Furniture and fixtures. Once again, both the next two categories, furniture and fixtures and equipment. If you remember, both of them, just in case we have emergency, we budget some chunk miscellaneous cost in there, so we don't have to have a special board meeting in case something comes up. So obviously, those two categories may also not be fully spent, but just in case they are, I'm showing $17,117 in furniture and fixtures and $22,099 in equipment, giving you a total estimated remaining 2022 at June 30, 2022 ended expenditures of $752,618. And that would leave you with an opening balance between cash and CD of $750,296. Okay. So I'm going to move in now to the budget. Expand here. Okay. So we have budgeted receipts. So for the budget year, July 1st, 2022, ending June 30, 2023, we have budgeted receipts of the following categories. And as you'll see that there's three categories here out to the right. There's a proposed budget at current rate, which is the rate you've had the last many years, which has served you well. You have a break even budget rate, which is a smidge higher, and then you have a surplus budget. This is how we normally present the budget in case you decide to change your tax rate. But I think as you'll see that your 3 cents will serve you just fine. But of course, that'll be up to you guys here in a little bit. Your individual line items, starting with your budget receipts and real estate taxes, projected to have $1,115,213, tangible taxes of $156,597, and motor vehicle taxes of $140,103. Those numbers came from a sheet. Let me get to it here. From right here, we get this from the state, which gets it from the Office of Property Evaluation. For you guys, we take these numbers that you're getting for real estate, tangible, motor vehicle. We plug them into our calculation estimator up here. We just plug those same exact numbers. We don't change them at all. We base the rates based on your 3 cents. And then we base it on a 95% collection rate in case there's a little percentage there of uncollectible fees to get our totals. And that is in your packet of how we calculate that. That's where our numbers come from. The delinquent tax collections is completely an estimate, which is why I'm showing an even 20,000. I'm completely basing that on prior year. I really don't have much to go on. That's the hardest receipt we have to estimate. Because it really varies. If you look in prior years, it really varies year to year on how much we get, month to month, even sometimes, how much you get. Sometimes you get chunk payments in that, and sometimes you don't hardly get anything. And that's per county, and even inside the county, that varies year by year. So we're estimating that the delinquent tax collections will be 20,000. And your telecommunications tax, which is pretty constant, it fluctuates up and down a little bit, but your telecommunications tax receipt will be $10,378. And then based on your receipts projected and your cash balance projected, we're showing that you are projected to have $4,618 in projected interest income from your checking and CDs. That would give you a total budgeted receipts of $1,446,911. And that would give you a total funds available before budgeted expenditures of $2,197,206. Moving into your budgeted expenditures, based on the revenues that we plugged in and were given, times the 2.8 cent fee to be part of the district, you owe back the district $1,387,144. Like I said, it's a standard 2.8 that we do every year. Under building maintenance and repair, you'll see snow removal at 2,000. Landscaping annual maintenance we have of 2,000. The office wanted to have kitchen countertops and lobby, some countertops in the lobby and kitchen done or redone. In the kitchen and lobby bathrooms, they wanted some countertops and things in there redone, totaling 5,000. And then miscellaneous cost. Of course, Pulaski is a big building, so we budget a chunk in there for whatever bad things can happen to the building, whether it's something with electrical or HVAC units go out. Those add up pretty quickly now with the units going out to help cover the cost there. That would give you a total building maintenance and repair budget of $29,000. Under furniture and fixtures, we always budget a little seasonal decor for things that need to help the office look a little better each year, for things that get worn out or break that were there before, $500. The office is needing a kind of a do-over, some chairs that they need 40 chairs for the basement meeting room and the lobby of $1,700 total. They need some outside door awnings, some new ones there for $1,800. They want to do a little downstairs decor and also get a new break room table for $500. And they're needing a new washer and dryer for $1,500. And obviously, we put a little miscellaneous in there for unforeseen furniture that may need to do like I said, something breaking or getting worn out for $5,000, giving you a total furniture and fixtures of $11,000 for the budget year. And then our final big category is equipment. We have equipment for miscellaneous computers and related equipment. Years ago, we decided to start splitting out two different categories under equipment for miscellaneous. This first one of miscellaneous computers and related equipment is for anything IT related. So if they need a new server, or if they need if multiple people need new laptops or new desktop computers or new printers or new scanners, that's what that would be for. And obviously those are expensive items. So sometimes when it rains, it pours, it's good to have that item in there to help assist with that, which is why we have that at 12,000. And there's multiple employees obviously in the Pulaski Health Department. So that can go quick, depending on the year. You guys obviously have that big generator now. So the next item is generator maintenance. That's for the guys who installed your generator to come check on that generator twice a year. To check on the fluids, to check on everything's working properly. So they do an annual maintenance check on that to make sure everything's okay for $1,200. The office is wanting a new paper shredder for $1,500. And then, of course, we have other miscellaneous costs, so that can be, a medical fridge may go out or may be needed, or anything that's not really any kind of equipment that's not computer related would fall into this category and for $10,000, giving you a total equipment of $24,700. There's some small recurring costs we do every year. You guys have an audit every year because your receipts are well above $500,000 required to have the audit under SPGE requirements. So the audit lately has been in the $1,400. So just in case they go up a little bit, we budgeted at $1,500. Your advertising and printing cost roughly is about $600. Your dues and subscriptions to be part of CalBOS, SPGE, and KPHA, $1,500. And once again, if we're able to meet again, we have board meeting board meeting costs for food and things like that for $500. That's going to give you a total budget expenditures of $1,455,944. And would give you a net surplus deficit before your optional expenses of $741,262. Or I'm sorry, that would be your cash remaining. You would have a net surplus. You would have a net deficit before optional expenses of $9,034. So as you can see, you are technically budgeting a deficit, but there are multiple items asked for to be bought up here. So you're actually probably more around probably break even there when it's all said and done, because more than likely we will probably collect a little bit more revenues than we budget. I'll show you all the trend here in a little bit to help you see that. So our optional expenses for the building. So our optional expenses, they're asking for flooring, and we did break this out in different sections. That's how the bids were done. So we have an option for flooring, environmental, hallways, and TB clinic. That was quoted at $22,000. They're asking for flooring for the main clinic of $32,000. And then they're asking for new pole lighting and wall packs of $13,000. I will say that apparently the pole lighting has been an issue for some years now, and the wall packs, all the wall pack lights around the building are at least a chunk of them, I think, are struggling. Bridget may be able to speak more to that. And I think the reason they're wanting the flooring done is because the flooring was budgeted last year in one section of the building, and now a lot of the flooring doesn't match, and the other flooring, I think, is getting a little older and everything now. So I think they're wanting to get that in the other sections of the building now. If you accept the optional expenses, it will give you total budget expenditures of $1,522,944. That would give you a cash balance remaining of $674,262 and a net deficit of $76,034. Before we shift back, and hey, if you have any questions, I wanted you to look really quickly at your trend. And as you can see, there are years. If you look at Pulaski right here, and I'll highlight Pulaski for you. Pulaski's through here, right here. You'll see that your net, you have a lot of years in net surplus. And as you can see, your average is around 28,000 you surplus. But there are some years, like I said, there's some bad years sometimes that come up where you have 40,000, which is why I say that 3% has technically served you well. So some years you have bad deficit, some years you have the surplus, just depending on what you're budgeting there. So that is the presentation of the budget. If you have questions, I'll take those now. If there are no questions, this will be when you go to accept the tax rate.
I've got some questions about the tax rate and so forth. We're required to have a tax rate of 2.8 cents, right? We can't at least that much. That's what goes to the district, basically. Is that what that is?
That is correct.
Okay. And the estimated taxes that we're going to collect are not based on what's expected. I know Frankfurt right now is debating on the property tax on vehicles. I believe that's not been settled. Is that right?
Yes, I think Amy might be able to speak to that a little more than me. I think that is definitely, I don't think, been settled. I think they've backed off that a little bit. Amy can speak to that more than I can. She's heard some more legislation on that, on how that's gone down. Amy,
there was a 40% increase in the vehicle tax assessment when you go to renew your vehicle registrations and things this year that was assigned. And the Kentucky State Legislature is attempting to pull that back slightly. And Judge Kelly may know more than I do, but I had originally heard that it was out of committee. The bill that was being passed to repeal that had come out of committee, and that they're looking at relief for owners on that. So I don't expect that our tax revenues are going to increase by 40%. I believe they're going to instead find a way to give the relief to the individual property owners in this instance. So I don't think that we'll be looking at a very much difference in our rates. Even the ones that have already paid that new higher rate, is my understanding that this bill would allow refunds to go back to them. So that's where I think it stands, unless I'm wrong, Judge Kelly. Do you know any updates on that other than that?
I've not heard anything in the last couple of weeks on that. So that I'll go with what you're saying.
I was in Frankfurt today, and that was the latest I had heard as of today. So
Well, thank you, Amy.
you're
I
welcome.
wonder if that bill is not passed and they don't manage doing anything like that, we're going to have a significant larger sum paid in with the 40% raise on at least on the vehicles. And with inflationary effects on homeowners' values and things, that's not being discussed in Frankfurt. Is that something the PVA office is they're pretty stable on that, aren't they? They're fluctuating with the inflationary cost of housing right now. That's not affecting the PVA's appraisals, is it?
I don't think so, sir. I think that it's the numbers that we have here are based on the last 3 or 4 years. It's a trend, and I think that that's probably, in my opinion, the best thing we have to go on for now. If we see that this is going to be an issue moving forward and that these rates are going to increase, that would probably be where I would look at, a potential lowering of it in another year or so. But I don't want to influence you either way. It's certainly your decision on how you handle this. It's your choice on raising or lowering the rate. But I don't think that there's enough evidence right now to support an assumption either way.
I understand. I'm just wondering if all this has been discussed or thought about. That's our job, is to ask
It
questions.
is. And the other county boards are having the same discussion. So you're not out of line at all by asking. I just don't know that I have enough information to predict what's going to happen at this point.
Judge Kelly, I appreciate you stopping by the other day at our place and leaving information for us and all that. But and it says here that you've lowered the property tax rates 2 years in a row for the county. Is that correct?
That's correct. And I mean, it's true. It's, the reason for that, Dr. Slater, is primarily because our property values have been increasing. But that's a sign of a strong economy. That's a sign of people, high demand for our property. People are moving to this area by the droves, and they're driving our prices up. So it's increasing net wealth of the property owners, but unfortunately, it is increasing the value paid by property owners as well. But it's like I said, it's a sign of a good economy. It's not a bad thing, but we have lowered our rate 2 years in a row. We basically take the compensating rate that generates the same amount of revenue as last year. So it's allowed us to lower it twice.
We had the discussion on the compensating rate at our last meeting for everybody here, and I don't guess that wasn't assigned to the health departments at the time. I think they said that might be, but they weren't sure. Is that something that's an option for us too, or no? Has that been decided?
The latest legal opinion that I have been given is that the compensating tax rate does not apply to health departments. If that were to change, I would certainly advise you all of that, but I have not heard for sure that that's the case.
Yeah, Sean just mentioned it last year, and I just thought I'd to see if that was applicable here or not. Okay.
It's still on my radar, and I'm continuing to ask and research about that issue, but I haven't gotten any definitive things other than there was a lawyer for the Cabinet for Health and Family Services that gave the opinion that wording and that regulation did not apply to health departments.
Thank you, Amy.
You're welcome.
So are we looking now then for a motion to accept one of these rates as our tax rate for the year?
Yes, sir. That would be your first step here.
Would there be anybody that would like to make a motion in that regard?
Well, I would make a motion that at the very least, if we can't really with good confidence lower the rate as the county has, I would certainly not want to raise it. I would propose that we leave it the way it is and make a motion to do that.
We have a motion then to accept the 3 cents per 100 tax rate. Do we have a second for that?
I will second it, Jim Hughes.
We have a motion by Dr. Slater, second by Dr. Muse. Is there any further discussion?
Judge Kelly, Rodney Dick.
Yes, sir.
I think I'm hearing right. We're not at all interested in raising the rate, right? We
That's
talked about
correct.
leaving it
We have a motion
prevailing.
to keep it the same, 3 cents per 100, which has been since I've been judge, I believe,
Okay, all right.
at least. Is there any further discussion? Okay, all in favor then of setting the tax rate at 3 cents per 100?
Aye.
Aye.
All right.
Aye.
And do we have any opposed? Okay, that motion carries then. Thank you all. I appreciate when we keep our taxes the same or lower them. So thank you all. The next item then will be the approval of the budget. So if you want to carry on, Ron, with that.
Yeah, the budget's been presented. You see the rates and the categories and questions there. If you have any questions, you can let me know. But when you do the approval, you will have to you will have to say that you approve the budget with or without the optional expenses. So I know whether to include them or not. Like I said, if you have any questions on the optional expenses, I think Bridget can answer most of those questions for you. And there is some documentation. There is some backup of these quotes. If y'all they're in your packets. If you want some detail on that, on where we got some of those quotes. But other than that, I have done the budget presentation, but I'm here for questions.
I have a question. I only saw one bid for the flooring from House of Carpets. And is it not customary to get more than one bid?
Yes, absolutely. Before we do the project, there will be 3. I think due to timing and availability, where I think Bridget can attest to this, where some people just not wanting to come out and some people maybe not having the flooring that we even needed. We didn't have the time before the meeting to get all the quotes. But yes, before we actually do the project, there will have to be 3, which is why I'm not having the board decide on a person to actually do it right now. I'm just having to see if y'all want to actually approve the cost. And then obviously we would approve the one that had the lowest bid, unless there is a reason that is somewhat significant to cause us to use somebody that has a higher bid. Like we've used the person many times. They've done great work. We don't, there's a couple different, but you have to notate that for the state. But yes, you are correct, sir, that you normally have to have at least 3 quotes, which we will before we did that project. But this is here to mainly approve the cost. And we had at least one or two quotes in each category, enough to give us a ballpark of what the amount will be.
So this would be sort of like a not to exceed this amount.
Correct.
Well, I think Patty from the House of Carpets is a wonderful person. And I'd say that with the labor costs, what they are doing, jumping up in the hourly rates and everything, that if we might be surprised that that's not the lowest of what we have. But another thing I sent to on these other expenditures is Judge Kelly is very well aware, and I've taken advantage for at least the last year and a half or so of the shredding business that the county offers for free. And I'm wondering why the health department's not utilizing that. I spoke with, or I left a message and he left me a voicemail back. The person at the shredding department, they have this monstrous shredding machine over there and they do it for free. And we used to shred stuff at our office. It's noisy. It's the machines are maintenance required and they cost a lot and it's messy. We have containers at our office. We just throw everything into lockable containers so that personal health information is not compromised and HIPAA is not down our throats. And we take it once or twice a month over there and they shred it for it. I think they'll pick it up or they might. I don't know. We might be arrangements. I don't know why you're having to shred stuff there anyway. I think that's something that could be farmed out. Is there anybody else doing what I'm doing at our office, having it shredded elsewhere?
We do our shredding through there. It's taken there once a month, but we have an enormous amount of shredding here. And right now we're in the process of purging charts. So we have boxes upon boxes just filled with papers.
Yeah.
And I mean,
over
it's
the same thing.
And they come here once a month, the maintenance does for the health department, and they'll pick up our shredding. But I mean, the boxes that we have here, it's just, unbelievable it's just a big amount. And not to mention, I mean, one time they took boxes, they rode off on their truck, and one of the boxes wasn't taped properly, and papers were flying out the back of the truck.
Yeah, that's not good.
No.
We keep ours in a locked container until they get there.
Well, we don't have locked containers, and I mean, we just put them in boxes, and the boxes get real heavy.
Right.
So
you're
the shredding
using
would
that
make
service-
it easier to, I mean, we could even do recycling every 2 weeks where they just come by and pick them up.
So you're already using that service.
We are, yeah.
Okay. But you've got some things that need to be shredded that you don't want to put away somewhere, or I don't
We just don't really have the storage here any longer. So our boxes are just sitting out, in the main areas. We have boxes at every at every clerk counter and stuff that needs shredded.
And I may be speaking out of line, but I think that Danny Maston would work with you to collect it as often as you needed it, whether it be weekly or twice a week.
Well, I mean, that's fine. I don't know if they're going to come and pick it up, but right now our maintenance just does it once a month. I don't know if that's just all the time that they have, because they cover, all the counties, 10 counties. So,
our local shredding thing doesn't cover 10 counties. Does it?
I think Bridget is saying our maintenance staff member that comes and picks up and takes to the recycling center. But we can certainly look at that. If that's an issue, we can look at having him take things to the recycling more frequently if that's the preference of the board.
I think, Amy, if you've got that much volume, I think the recycle center would pick it up.
Okay.
So that might be an option to check with them and see if that's something they would do. Because if there's that much volume, they probably would.
Yeah, he told me that he'd be happy to work out whatever's necessary, and that would save. I've had shredders that don't last long, and they are horrible, messy, and I just don't see the need for that. I would think that with this giant machine that we have over there, and it's not 5 minutes away, so I can't see that we need to do that. So I'm going to ask that you not get a shredder, but you just work with the people that are doing it. Like you said, you got them in big boxes as it is, and you're using that service. So I don't see the need for $1,500 shredder.
Hey, Harvey, I do, Dr. Drake, I do the same thing. I take mine over there, and that staff, the little blonde head lady in the back, so good about doing it. And plus, you didn't even mention the staff time it takes to shred stuff. You didn't mention that. That's another saving.
So yeah, I just
that's fine with me as long as maintenance. Right now, they're scheduled to come here once a month.
Yeah.
So I mean, if they could come here more often, that would be great, because there's sometimes we have 20, 30 boxes full of stuff that needs to be shredded.
Yeah, and that's not a good thing to leave laying around, like you said.
It's not. And when they don't secure it properly in their vehicle and papers fly out, that's not good either.
Yeah, if you'd like, I would send you a copy of the lockable box that we use. We have each desk, and somebody needs one, they just slide it into this little slot. You can't see it. It's locked, and they can't come back out unless you have a key. They're pretty handy to have, and I think you would really like those. If I can email that link to, who would I send that to?
You can send that to Bridget or to me, either one, Dr. Sleater, and we'll look at it. Okay. Would you be comfortable, because that would be a purchase in addition too that we would have to do. Would you be comfortable with amending the budget then to, instead of including a paper shredder, to include these boxes? And then
Yeah,
I will adjust the maintenance schedule to pick up more frequently, or I'll contact the recycling center to pick up for us or something.
I think that would be better. These things cost maybe, I don't know how many you would need, how many containers you would need, or what size. I'll let you look at those and see what you think, because they need to be convenient and maybe, yeah, I think that's a better way to go about this instead of trying to do in-house shredding. I think that's just too messy and noisy and not conducive to, and like you said, staff time. I'll send you that, and we might allow maybe $1,000 or something for those.
Okay.
Plus or minus some, because they're not cheap, but they last forever and you don't have any maintenance. So
Okay, well.
Could we
if
leave
I-
the same amount, but just put it for the containers instead of the shredder?
that'd be fine, and that might actually be what's necessary for as much stuff as you have. I mean, one of these I'm looking at is about a 65-gallon mobile with wheels, like a regular thing that's lockable. It's $390. So the one that we use at our office is about $180, and they're like a big tall trash can with a lock on the top and a slot on the side. So I'll let you guys look and decide, and I can show you what we use, but you'll probably spend $1,000 on those, at least maybe 15. So
For the ease of the budget, then can I ask that you leave that as $1,500, and we'll change it from paper shredder to lock boxes for shredding, and we'll make the arrangements, like I said, for the recycling arrangements. And then there's often many times that these budgeted amounts are not met, so that will just carry over then to the next year's budget. It would be, if we don't go to the 1,500, you know what I'm saying, it will go back into your account.
Oh, I'm very.
And we'll be very judicious with the use of the money.
I'm sure you will be. And you guys are always been top notch on that. Yeah, that's fine with me. Leave it where it is.
Okay.
But make it for containers rather than a shredding machine.
Okay, we'll work on that, and I will contact the recycling center to see how we can increase our frequency of getting that done.
Thank you.
And if I'm not mistaken, we did have a motion in a second, right?
If we did, Judge, I didn't hear it. And
I don't think so, no.
If we did, I definitely didn't hear whether or not it was including optional or not optional expenses.
Okay, so then we need a motion then and a second to accept the budget with the optional expenses.
The optional expenses is the lighting and the flooring, and that would be your choice if you choose to go that route or not. So a motion to either include that or not include that in the budget.
I'll make a motion that we include that into the budget for this year.
I second it.
So let's see, was that
I think it was Reggie and Dr. Schluter is who I heard.
Okay, so we have a motion and a second. Do we have any further discussion? I'll just for the record, I'll point out that I think the trend shows that we have been putting a surplus. So that should, instead of being a negative, we should end up close to even there is my thinking in this. Would you kind of concur with that, Ron? Just, I mean, can't guarantee that, but with the trend we've been having.
Yes. With all the optional expenses, you could be in a deficit position this year. But yes, much better probably than 76, assuming your building costs don't have some bad things happen this year in equipment and stuff to the building. I would say yes, you'd be more in maybe a 30 some to $20,000 deficit instead of a 76.
And we've got about 35,000 give or take built into miscellaneous that may or may not happen. So
correct.
I feel pretty good that we can meet that.
Sure.
But we do have a motion and a second. Is there any further discussion? All in favor?
Yes.
Aye.
Aye.
Is there any opposed? Okay, that motion carries. All right, thank you. As a lot of work, Ron. Next item then will be the board members whose terms expire. Amy, you want to speak to that?
I can, or Bridget, do you have that list in front of you? Do you want to talk? I don't want to take your meeting. You're muted, Bridget.
Okay. Well, hold on. Okay, I believe it's, and now I think last year it was done over electronically, so we don't have to do paper anymore, but I believe it's Becky Whitus, Reginald Cheney, Jim Wesley, Bruce Jasper, and Dr. Schleter are the ones that need to renew. So, I mean, if they're all willing to renew, I can just do that for you over the website, and then they'll just send you paperwork as far as for your renewal.
Fine with me.
I'm okay.
Yeah.
Was mine in it, Bridget?
No, I think we did you last time. No, yes, Reggie,
yeah.
you are in it. You are.
Okay, yeah, it's all right with me then.
Okay. I mean, there's no signature involved or anything like that. It's just reappointing to serve another term.
Is there any vote required there?
No.
So it would just be something I sign as the chairman?
It's just reappointing them to, I mean, they just have to do this annually and this their turn. So.
And I assume that Jim will want to keep serving if he's able.
Right.
If he's unable to, then we can deal with that at another time.
Dr. Jasper's texting me. He said his mic isn't working and he agrees to stay on also. So.
Okay. Well, I'll just go ahead and get that done, and you'll receive something from Frankfurt showing that you've been reappointed.
I think this is usually, if I'm, and I may be mistaken because this is my first time going through this really, but I think they usually do this closer to the end of the year too. So it may not be something that we take care of right away. We can go ahead and take care of it now, but they may not send the paperwork until closer to the end of the year. So.
Right.
All right, then we can move on then to the appointment of the members to serve on the district. And I guess what we have there is Dr. Falazade. We need somebody to serve in his stead. Is that
Yes,
correct?
sir. Yes. Your current members on the board, the district board, are Patty Gwynn, Dr. Perkins, Dr. Jasper, Jim Wesley, and then you're appointed de facto. You're automatically on, Judge Kelly, and then Dr. Falazade was also serving. And if all of those people are willing to continue, we'll just need a replacement for Dr. Falazade.
I'll be glad to take his place. Dr. Drake.
Okay. It's good if we have a medical doctor that's willing to step up. So I appreciate that, Dr. Drake. We have a certain criteria, a breakdown of members that we're supposed to have on the district board so that to ensure the evenness of representation. And we are actually deficient in the MD category. We don't have enough on there. We should have 8, I think, and we only have 4. So I would appreciate that if that's the.
I'll be glad to. They still meet at Russell County. Is that where they still do it?
Yes, I think our March meeting will still be virtual this time, and then we hope to get back in person then in June for our budget and planning meeting.
Okay.
So we don't need a motion for that then? It's an appointment I need to sign off on?
Actually, we have made motions on this on the previous county. I don't know if that's how you all
need a motion on.
Yeah.
Well, I would love to endorse Dr. Drake for that position. I think he's fantastic.
Thank you.
Can we, I'm sorry before we go farther, can we just make the motion to accept the slate then of the ones that it would be Dr. Drake to replace Dr. Falazade and then the others remain if they're all willing to continue? That would be a simpler motion and it would only take one vote.
I'd make that motion.
Thank you, Dr. Schleter.
I second it.
So we have a motion and a second there be any further discussion? All in favor?
Aye.
Any opposed? Motion carries. Okay, then we'll move on to the election of officers. I'm gonna apologize to you. My battery on my iPhone is getting low, so I'm gonna take my video off and move my phone around to charge it. So if you want to go into
your current officers are the chair is Judge Kelly and the vice chair is Dr. Jasper. If they are both willing to continue, we can just make a motion to accept that slate again. I will say that Mr. Crabtree has previously been serving as the secretary to the board, and that's something that I'm willing to step in and do in his absence since his retirement. If that's the desire of the board, I don't care to do that. It allows someone here at the district office to do some signatures and paperwork on behalf of the board that makes things a little easier on you all. So if that's your preference, I'm willing to do that as well.
I make a motion that we do that.
Second. Second it, Dr. Drake.
Dr. Jasper, can you text me? Are you willing to continue on as vice chair? I assume you are. He says yes. Okay. Judge Kelly, if you're there, I think we have a motion and a second. You may have got disconnected. There you are.
Can you hear me now?
Yes, sir. I can hear you now.
Okay, we'll take a vote then. All in favor?
Aye.
Aye.
Are there any opposed? Motion carries. And next item then, I guess, will be the executive director's report.
I will be brief. I just want to introduce myself to those of you all that may not know me. I'm Amy Tomlinson. Mr. Crabtree's last day here with the district was July 31st, and my first day as solo director was August the 1st. The district board actually appointed me on June the 14th, which allowed about a 6-week overlap with Mr. Crabtree so that I was able to train and learn a few things from him on how the process worked. And while I'm new to the role of director, I'm not new to the health department. I've been here for over 17 years in various different roles. I have a master's degree in public health from Western Kentucky University, and I'm very excited for the opportunity to serve in this capacity. I'll give you just a brief update on COVID and some numbers there, and then I'll also talk to you a little bit about the district as a whole. The incidence rate for Pulaski County, as was reported tonight by the state numbers, was 50.3%, and that's been coming down steadily over the last week or so. So we are hopeful that the Omicron surge that we've had to endure since about the first of the year is ending, and we're kind of coming out of that now. The state positivity rate is 17.16% today, and that's down from well over 30% just a couple of weeks ago. So we are definitely seeing a decrease in some of these numbers, and I'm very thankful. Pulaski County as a whole has about a 51% vaccination rate against COVID. So that number is not as high as I would like it to be, but it's better than a lot of the other counties in the state. And it's not the lowest in the district. It's actually one of the highest across our 10-county district. So the biggest message that we have for the health department is that the protective factor for the vaccine right now, the more recent your boost dose, the more protection you seem to have against being infected. At least serious and severe outcomes if you are infected. So we want to encourage that boost dose. A lot of people have had their primary series, but they have not had the boost dose. So that's where our focus is now. As far as the district health department goes, things are going pretty well. We're having slight difficulty, as most places are, with hiring and retaining staff at this point in time. There's just a shortage in the workforce in general across every variety of sector. But I wanted to say that as a 10-county district, we are going to be celebrating this year our 40th anniversary. Our 10 counties came together in July of 1982, and that's recently just came to my attention. So I would love to be able to plan some sort of a celebration to honor that for the summer and invite all of our board members to participate in some sort of reception or whatever the fun activities are that we're allowed to do and able to do at that point in time. But when I started researching this, it came to me that we're the oldest and the largest district in the state of Kentucky, and that's quite an accomplishment to stay together this many years as a district and to put aside personal differences and county lines and work together as well as we have over these years. So I want to do something to honor that for sure. It's a major accomplishment. Our health department staff there in Pulaski County has done an amazing job of vaccinations over the course of COVID. I can't tell you the thousands of numbers of vaccines. I have a sheet here that's actually in my backpack somewhere, probably because I've been traveling today, that tells exactly the exact number of doses administered of vaccine across the county, but it's an unreal amount. And the amount of work that our nurses and our clerks and everyone there has had to put into over the course of COVID, I just want to give them a huge pat on the back and thank them for their service, because, this has not been easy on anybody. You all know that in your professional roles and private lives, it's not been easy on anyone. And to ask our health department staff to put on so many different hats and take on so many different roles over these last 2 years, I just can't express my appreciation enough for them. So I guess I will be short-winded and try to stop there, but I'm always available for you all if you have questions or comments or complaints or anything that's going on at the health department that you need information on. I am certainly willing to discuss with any of you at any time. If you don't have my cell phone number, Bridget can give that to you, or you can get in touch with me here. Just call the operator at the district and get through to me, and I will be happy to share that with you so that you have that and you can reach me at any time. Thank you all for your service, and I will be in touch with more details about any possible celebrations we may be able to do for our 40th anniversary this year.
Thank you. Thank you, Amy, for stepping up and doing such a great job. Anybody have a question for Amy?
Amy?
Yes, Dr. Schluter.
I've got one more. Boy, you guys are going to be tired of listening to me.
No, you're fine.
I got an interesting letter from LGE and KU today, and maybe I'm sure it was a mass mailing they sent out to everybody. But we did our lighting at the health department a year or two ago. If you remember, they changed over and converted to LEDs. They are offering rebates for those expenses. I don't know how much, but I don't know if anybody else has heard about this. Franklin Energy is offering rebates for upgrades that were done up to 2 years back. And I think that would qualify. I think we spent, Judge Kelly would know what it was. It might've been 13,000 or I forget what the total cost was for the health department lighting. But I would like somebody to contact Franklin Energy at business.rebates@franklinenergy.com and see if the health department may be eligible for rebates on the expenses they had from doing the lighting a year or two ago.
Would we go through Franklin, or would we have to go through KU here locally?
Well, it says, let me give you a number to call. That would be the best thing to do. It's 855-878-1496. And that is, I think it's Energy Efficiency Operations Business Rebate Program. And it's actually business.rebates@franklinenergy.com. So I'm not sure, but I sent the guy a email and he responded saying it was good for expenditures up to 2 years ago. And I think that we would qualify. I don't know how much it is. It may be a pittance, but something we might be able to get a few dollars out for the health department expenditures a year or two ago.
That's I mean, every little bit helps. I know whenever we went through our energy projects here in county government, not only did we get the savings of getting better lighting, but we also got a $25,000 rebate check just for making the investment. So yeah, it's definitely available if you contact the right people there.
Well, I'm not sure who would do that, but I just am throwing it out there so that somebody at the health department would look into it. Maybe make that phone call might be worthwhile.
I copied down that number, Dr. Schluter, and I tried to write down the information that you shared. So I will make sure someone follows up, and I'll get back with you on the outcome, what that may look like for us.
Okay, very good. Thank you.
You're welcome.
Great. Anybody else have any questions for Amy? If not, then we'll move on to the next, which is the diabetes report.
I think the diabetes staff were not able to join tonight, but they included a sheet on your packet. It should be the very last page of your packet, I believe. It's a front and a back of, if I'm mistaken, to page 29 and 30. That just has some statistics and some numbers about diabetes rates in the county and numbers specifically for their program. So that's something that you all can review and look at your convenience, kind of like the report Melanie gave at the beginning of the meeting. If you all have questions about anything related to diabetes or the diabetes program, you can direct those to me or Bridget, and we'll make sure that someone from that staff gets back with you and answers your questions.
Great. Do we need to, at this time, set a date for our next meeting before we conclude?
I don't believe so, sir. I think that these are usually set closer to time since it's a year out instead of quarterly. So Bridget will contact you all about the next meeting date, but it'll be sometime next February, unless there's a reason for a special call meeting.
Okay, great. Well, if there's no further business, we'd entertain a motion to adjourn.
So move.
Do we have a second?
I second it.
Okay, we have a motion and a second to adjourn. All in favor?
Aye.
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 And any opposed? You all have a blessed evening, and we'll talk to you soon.
Thanks, everyone.
Thank you.
Thank you. Thank you.
All right, get out of that Zoom. How do I do it?